With the end of the year deadline, it appears this bill is now in a race against time. Congressman Elijah Cummings joins us now to weigh in. Good morning.
Good morning.
Now, the president is hoping to get this passed tomorrow. It is a 10-year, $1.2 trillion bill. The chances of this getting passed is really a fight against time at this point.
It is a fight, but we're going to pass the bill. There are a lot of people right now who are watching us right now who are lying in bed, cannot get the health care that they need. And this bill will address that. And keep in mind, this whole idea of pre-existing conditions, the Democrat bill will get rid of the pre-existing conditions. The Republicans have put forth a bill, but basically it's the same old, same old. They basically don't insure it. They insure about maybe another 3 million people when we've got 46 million plus uninsured and counting every day. And at the same time, they leave in pre-existing conditions. They still say that if you've got a pre-existing condition, you can be turned away from insurance, no matter how much money you may have. And that's still a problem.
Unfortunately, money is a big issue right now with our economy being the way it is. Under the GOP bill, the nonpartisan Congressional Budget Office says it would leave millions uninsured, as you were saying. However, it would save a lot of money in the long run.
But it does not help Americans. See, one of the things that it doesn't do, you got to keep in mind, people who have the insurance can keep their insurance. But the problem is that the cost of insurance is skyrocketing, and the GOP proposal does nothing about that. And the Washington Post has made that clear. It's a terrible plan. Basically, I don't know what they are thinking. They assume that this problem is going to just go away. Well, guess what? It's not going away. It's getting worse and worse every year. And so you can't continue to allow premiums to go up the way they're going up. And that's what we've tried to do.
But if we continue to spend money, won't that damper the economy? Isn't that hurting us even more in the long run?
The Congressional Budget Office, and we don't control that. That's an independent body, has said we will literally cut the deficit because we'll reduce the cost of health care with the Democratic bill. So, you know, I wish, and I know people are upset, but they need to read the bill, and they will understand that this bill probably will help 95% of the very people that are protesting, would help them and their families.
Congressman, let's talk about the chances of this actually passing. First of all, do you think that it will be ready, the draft will be ready for you to vote on tomorrow?
I would just, it has been filed, and there have been amendments that are filed. We will vote on it. We'll start voting on amendments probably tonight and tomorrow. But yes.
With the public option in there?
With the public option in it. The bill will pass the House, I predict, with the public option in it.
And now if it does, let's say that it does pass the House tomorrow, it would head to the Senate. What happens if the Senate does not approve it by the end of the year deadline?
I would love to. First of all, I believe the Senate will. And I know there's been some talk that they may not. But even if it does, we'll do it in January. In other words, they will pass theirs, we'll pass ours, and then it goes into conference, and then we'll come out with a bill.
Let's say time is not on the side for this bill, and it doesn't get passed by January. Now we're heading into an election. Does that damper it? Does that,
I think it makes it a little more difficult the closer we get to an election.
Right.
But this is a moral issue too. Let me be clear. You know, we can sit around and talk about how we don't want to reform health care. Well, if we don't do it now, it's not going to be done probably in the next 30 or 40 years. So if you want your health care costs to go up, your premiums, and that's almost every single American, then you're against the bill. If you want them to be reduced, if you want to get rid of pre-existing conditions and things of that nature, then you want this bill.
Congressman, before we let you go, we know you have a big thing coming up on Monday, a college fair.
Young people trying to go to school, come Monday. We have our college fair at Dina Pratt Library from 5 to 7. It's absolutely free. Please come out.
Future generations.
Future generations.
Congressman Elijah Cummings, as always, thank you very much for coming in.
Thank you.
Congressman Elijah Cummings, How to Pay for College seminar is at the Enoch Pratt Free Library Central Branch, as he said, on Cathedral Street. It is happening Monday from 5 to 7 p.m. Coming up in our 7 o'clock hour,